All right, all right, all right, all right. I get them. I get them now. I get them now. Hello everybody. I'm Mel, and welcome to Coconut Wireless. I told you guys last time we were on this whole new system, and there's so many toys, so many bells and whistles that sometimes I screw up, and that's what I did tonight. But anyway, I hope you guys can hear me and see me. Let me know if you can hear me and see me. Just give a thumbs up or whatever. Um, that one, they're perfect. Okay, Sam is saying perfect. Awesome, 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 awesome. Let's see. Boom. There we go. Perfect. Beautiful. Welcome everybody. We got a great show tonight. So before we bring on our guests and talk story, I got to do this. Yeah, I know. Stupid, but what the heck? It's fun. It's another button I can push. So tonight we are going to be talking about health. New name for the show. Yeah, we went with Coconut Wireless because this doesn't limit us to anything. We can talk about whatever we want, and that's why. And so it's all cool. It's all cool. Thank you guys for joining us. Tonight we got Dr. Kaohi Akiona. You guys remember her from the Mel and Charlie show days, and we haven't seen or heard from her in a while, but she's been busy. And tonight we're going to be talking about health equity and something that is a problem all over the country and even more so here in Hawaii. I did want to play a very short video because I was looking over the internet and finding out, I wanted somebody to define health equity. So here we go.
Hi, I'm Mighty Fine. I'm an expert with the American Public Health Association, and today we're going to talk about health equity. Let's imagine that you're a baseball fan on your way to a game. But when you reach the stadium, there's a wooden fence blocking the view. Some people are standing on milk crates to catch a glimpse. Some are tall enough to not even need a crate, but they're standing on a whole stack of them anyway. And some are standing in a ditch where even a crate couldn't help them. So some get to see the game and some don't. We face a similar situation in public health. There are people who can easily access whatever resources and services they need, and others who struggle to get the basics, like healthcare, clean water, safe housing, education, and a livable wage, which means that certain groups of people are more at risk for disease but have less ability to get treatment. So they may be more likely to get severely sick or die from treatable and even preventable diseases. Let's go back to our baseball example to explain more. Just like a difference in height helped some people see the game, many health outcomes are a result of things we can't change, like age or genetics. Bones become more brittle as we age, so we'd expect 80-year-olds as a group to suffer more hip fractures than 30-somethings. On the other hand, back at the game, some people weren't naturally tall enough to see and didn't have any crates, and others were forced to stand in a ditch. Likewise, many gaps in health trends are caused by a lack of access to various resources and are rooted in unfairness. A person's education, income, employment status, and housing all have an impact on their health. These are what we call the social determinants of health. And when non-medical factors like these contribute to a difference in health, we call that difference a health disparity. Like Black mothers are almost 3 times more likely to die in childbirth than white mothers, and are less likely to have access to quality prenatal care. There's no biological reason for this, but there is a strong history of medical racism towards Black women. So this is an example of racial inequity, or the unfair and unequal distribution of resources along racial lines. When addressing health disparities, some focus on equality, which would mean giving the same assistance to all. But this doesn't often work in practice because some people need more support or a different kind of support than others. An online portal that lets you quickly sign up for vaccinations is a great idea, but for people who don't have internet access or a car to get to the vaccine clinic, it's still a one-size-doesn't-fit-all solution. That's why public health professionals are focusing on equity. An equity approach strives to give everyone the chance to live their healthiest possible life, but gives extra attention to those who face ill health because of a lack of access or opportunities. Like the more than 2 million people in the US who don't have access to running water or plumbing. Some of these folks have no choice but to get water through old, poorly maintained pipes, which can lead to serious infections. And the people affected by poor water quality are disproportionately communities of color, children, older adults, and low-income or rural communities. Historically, less affluent neighborhoods haven't received enough funding to fix their water infrastructure. To make sure this problem is handled equitably, APHA recommends that federal and local governments use any extra money to improve the water infrastructure in those neighborhoods. APHA also recommends that governments, schools, hospitals, and other branches of public service work together to identify and provide the specific support the communities need so everyone can live their healthiest possible life. So that's health equity in a nutshell, a public health approach that tackles health differences which are avoidable, unnecessary, and unjust, and works to improve everyone's health.
I hope that made it clear for you. Dr. Akiona and I had a little chat a few days ago, and she was sharing some of her experiences. And I thought, what a great show it would be if I could bring her on and talk about health equity. So let's bring Dr. Akiona on, and there she is. Dr. Akiona, can you hear us?
I can hear.
Okay, we can hear you now. I need for all of you guys out there watching to tell me, please tell me there is no echo. Please tell me there is no echo. We did this last week and with the Bernard Cavallo, and we had a horrible echo. So I want to make sure that we have no echo. So for those of you that are listening, please tell me that there's no echo. No echo. Thank you, Sam. Thank you. Thank you. Okay, I fixed it. I figured it out. All right. Well, Doc, welcome, welcome. Long time no see. And for those of you that don't know, Dr. Akiona has been she's been pounding the pavement, helping to bring health equity, not only on the Big Island, but recently in Molokai. So I'm going to turn it over to you, Doc, and you can share with our viewers what you've been up to, and then we'll get into the discussion about health equity.
Hey, no, it's really nice to be back. I think Uncle Mel knows that I miss talking to him. Everybody's been busy. I think so. We've made over a year now. So I still talk pretty regularly with Dr. Miskovich, but I did leave his practice. So, um, right, last July, we opened up a clinic, and it's an interesting location because I'm in Hapuna. So we're kind of in this weird mixture of we're set at the Hapuna Beach Resort, and I think a lot of people were trying to figure out like what was going on. And what it was is we realized we could kind of we could support one of the largest employers on the coast, and they really wanted to make a investment in the well-being of their employees, majority of which of whom are either they catch the bus or they drive in from my side of that, from the east side or from Honokaa. And so a lot of the people that work there were having harder time accessing care. And so I think we both Misco and I, we really did think it was a good opportunity to take care of the people who take care of all the rest of the people that come visit. And we were really, really happy to be kind of like nicely aligned with their employer who, understood the health of their employees is really important. And they wanted to make sure that there was access to the community. So I did that. We started our clinic in Hapuna in July. And then I think a lot of people are aware, but we've been losing physicians kind of through whether natural causes, so people just retiring or just leaving, and then we had a series of pretty tough deaths, and especially in the Native Hawaiian physicians. So I mean, I'm part of Ahuhuina Kaukam. I got looped back in by Dr. Kapono Chong Hansen, who is he's your Kauai guy, and so we were just, I wouldn't say we were, shocked too much, because we know we're all getting older, but it was just, I mean, we lost so many people all at once, and we watched Molokai in particular. So that's what that's what I've been doing for the last since May now. We watched just a loss of access to care pretty quickly. The situation was already bad before, and then it just got way worse. And I know that you guys heard me talk about it during the pandemic, but it's just like, it's all of the smaller communities, like no matter where you are, it's really tough, but nobody should get left behind. And I think, we were realizing that the gaps that already existed were getting wider and wider, and that there really wasn't anything happening. So in May, we I wouldn't. I opened another branch of our clinic in Molokai, so we've been on Kaohi since May 15th. It wasn't the. I wouldn't say it was the best laid plans, but we knew it. So we needed access to care. So I was going over 3 days a week from May 15th, and we're still there. That has been a difficult endeavor because we have the most skeleton of crews possible. The nice thing is, I think, when I was talking with everybody and I've been able to kind of think about how things are going, is I get to see and witness how things are going in several counties now, and it's and that's I think what we're going to talk about today is just processing through like what
Yeah.
we're seeing.
You shared some stories when we chatted, and which really made me. I think a lot of times we take healthcare for granted because we have access, and the clip that I showed you, he spoke of the categories of uh, disparity, right? Uh,
Yeah.
People of color, the poor, rural communities, which is where we are, and it's hard to imagine that in today's world, in this country, and even in this state, that we have uh, two people, same diagnosis, same
Mhm.
age, same everything. One person gets healthcare and the other doesn't. One person gets treated and does well, one person doesn't and dies. Why is that? I mean, is it purely funding? Is it insurance? Why are we seeing that? And especially in like Molokai, right? Our Native Hawaiian communities, our Marshallese communities, all of these vulnerable demographics that don't have access. And the one example he talked about was about vaccination clinics. And he said, it's great if you have online appointments or reservations, but if you don't have a computer or you don't have a car to get you to the medical services, then you may as well not have the medical services at all because you don't have access. So why are we at where why is it like that here in this country that we live in?
It was, it's such a complex thing, and I think some of it was, not, I wouldn't say complacency, but just um, when it doesn't really affect us individually directly, really, like, kind of, when it's not staring you in the face, I think it's easy to just assume that the problem is not nearly as bad, or that that individuals have more control over their choices, right? So then it's like, oh, I remember doing like I got assigned a navigation project, so I was supposed to do this cancer patient navigation project, and the way they approached it was, why are the patients, like, putting it on them, like, why are they so bad at accessing care? And that it was just assuming that there was some kind of innate problem with the patients that they were studying accessing the care or making choices, right? And then when we really drilled down to it, it was, okay, so they can't get healthcare, they can't afford to take off from work. There was a lot of, it was so much more complicated, and that's what I think the hardest part for what I'm doing now. So I think I talked to you about that, is like, back then I was a researcher. Back then it was statistics, and it was, we're looking at trends. So we're looking at percentages, and these are like arrows going up and down. And then now in the job that I do now, it's, I spend a lot of time with the faces. So then, when we say, so these people don't have access to transportation, like, I'm in the room with the family talking to them about, how difficult it is to get, you know, uncle or auntie to their neurology appointment. Or, I mean, in the case of Molokai, it's just like, there is only one option to South Island. And then, like, I'm already coaxing them, trying to, like, hey, like, no, let's do this. Like, I'm trying to encourage them to access care, but it's just like an uphill battle. So it's not so much that their choices are the problem, but like their ability to make choices in general. They don't even have a choice to begin with. And then, when it dawned on me that we're not paying the exact same, but we're all paying a premium for our healthcare. So it's like, if I'm paying my premium on Oahu and I can access, what I need, and on the Big Island might be a little harder, but I can figure it out. And then on Molokai, nothing. It's like, we have to jump through so many more hoops. That to me is that concept that you showed of that equity. Regardless of what their personal choices are, they barely even make it to be able to engage with the system anyways. And the hard part that I think that weighs on us is it's like it's not a statistic anymore. We are talking to the actual people and the families and the communities that are affected, and it's looks like you and me. And I think that was the conversation I had with you is the patient that looked just like my dad, and it's like the difference being location. So he's a different county, and just like my family was always Kaiser, so we had very controlled care. We have access. We've always had good preventive health care, and when you take that away or when you don't have that, just how your life is, how it turns out differently with exact same diagnoses, same age, same otherwise, everything going the same. Just it's like night and day. And I think that was my thing for when I talk to politicians and when I talk to everybody else. The people suffering are you and me. They look like you and me. They're not like, somebody making crazy choices. They're not, the even when I'm talking about homelessness, right? It's no longer who you think it is. These are like, now it's working people with kids who are trying to work. And it's that I think is the hard part of healthcare right now.
And you have been right there, right? I mean, from the Big Island. I mean, during the COVID days and even post COVID, your Kohala clinic. By the way, I have this little. I got. I think I know who this is from, but is that who I think it's from? You see, or you get to see the comments?
Cool. Let's see. my my daughter's on.
Ali'i? Oh man, I saw that. I'm thinking, oh gosh, okay. Hi, mama. So, but anyway, back to you've been out kind of like street medicine, trying to do preventive care and helping out these less fortunate individuals that absolutely have no access. I mean, they just have, and like you said, even if they had a car, they just where do they go? Who's going to see them, and who's going to guarantee them appropriate and adequate care, rather than to just come in and give them a couple of Tylenols or Advil and say, okay, this will work. I mean, that I think is where and I'm not a doctor. I mean, I've always had access to, even on neighbor islands, we have, we don't have the level of care in many cases, and oftentimes we need to go elsewhere. But at least the preliminary care, the basic care is here. But I couldn't imagine what it would be like if there was just nowhere to go. And so many people, and I'm sure you're seeing more of it now in Molokai. How do you deal with that? And how? And I don't want to talk about you specifically, but how do doctors today? I'm hearing from doctors and medical professionals that our doctors are actually leaving the profession because it's just very difficult to provide the adequate care and be compensated, not to get rich, but to pay the bills, to pay the
Yeah.
insurance, to to buy the equipment, to pay your staff.
Staff.
How does that work? I mean, at some point you can only give so much, and then you got to feed your family as well. But I'm hearing more and more that is that common? Is that becoming
Yeah.
common now?
I mean, I think it was kind of crazy because it's like that empty cup kind of situation, right? Like people kept on telling, I mean, and to his credit, Dr. Miskovich too, right? He's telling me you cannot pour from an empty cup. Like this is a problem that is bigger than one overworked physician. I mean, I'm surrounded by good people, right? Like Dr. Knox and Dr. Kong, and they're like, you understand that? And I said, no, I totally understand that. Like I don't think I'm going to move the needle. But if I can, I remember talking to the county of Maui, and so a couple of their liaisons, right? They said if you help one person or 500 people, just showing up is kind of an important thing. And I told them like that was what I truly believed during the pandemic. It's like my daughter used to come with me on street medicine, right? And we used to go out, and I told her it's not so much about the numbers, like we see as many as we could. I had a really good team, and I had Jesse Ebersol with me, and he had a good connection with the medics and the community. And numbers are good, but it was like you just show up, because for them consistency mattered. So they maybe didn't trust us the first couple times, but they would come around. They knew that we were always going to be there at a certain time on Wednesday nights, and they would engage with us after, right? So it's just being consistent. And I think that is the problem, or the difficulty for what we have to do, because for smaller communities, for any community, I mean, I'm from Wahio, it's like you got to be consistently showing up, right? You got to just, and in order for you to do that, you have to have a plan for longevity. You have to be able to not hit the ground, making a ton of visits and like all this overhead is that you're going to be fine. So like it requires a little bit of a gamble. And so we know we're going to spill our contents. We're going to pour our cup out. And then I told them, when I'm taking care of the patients, it's good, it's fulfilling, but all of the other stuff around it. So I think the biggest thing, I did give a talk on a panel for health disparities. And I told them the hardest part is looking the medical disparities. I mean, these people embody all the disparity, all the problems that we want to solve, and not feeling like you can do anything anymore. And I told them, like, though, that's the moment, right, where a lot of my friends, my colleagues are like, I don't think you can do this anymore, because we didn't sign up for that. We didn't sign up to kind of bang our heads into the wall and, want to help people. We're trained to help these people, but either we lack the resources or we lack the control or the autonomy to access them. It's somebody else's kind of decision. So, I mean, my friends, it's sad because some of them recognize the burnout before it's happening and they step away. So some people have just stepped away. Some of us, we don't recognize it until it's too late. So we are actively, on fire while we're like trying to figure out like what's going on. And I think it's true of multiple kind of professions, but I think particularly like primary care and the people kind of on the front lines, emergency medicine, where it's just the futility of it all kind of, I think it weighs on us. And sometimes there's not enough of the good kind of feel good moments to carry you through. Or in some cases, like in my case, we have regular families, we have family emergencies, we have real life emergencies. And then it's like, what do we do? Where you're burning the candle. I was burning the candle on both ends. And then how do you right the ship? And I think that's the hard part to explain when we talk about like access to care, right? It's like, in order to have good access to care, you have to have good providers, and your providers need to be healthy and they need to be supported and they need to not burn out. And so the system has to not be actively setting them on fire. And and that is the difficult part.
I know the Maui County. In fact, that we met a mutual friend, and while I was on the mainland at a conference, and one of the council members there was sharing that they were, funding some of the services there on Molokai. So what is Molokai like? I mean, do they have a hospital? Do they have a clinic? Yeah. I mean, aside from what you're doing, what is there available for the Molokai residents that have medical?
Yeah, and I hate to pretend like I know everything, right? I mean, I think we're aware. So most of the healthcare people, we understand. There's some Molokai generals there. They have a hospital. They have an emergency department. They have the ability to have see people, and even hospitalize people there. There's an outpatient clinic attached to the hospital. They have a lot of facilities. They have a lot of services there. Physical therapy. They fly in and have a lot of specialty care. They come from off island, several times a month. Apart from them, there's a community health center down the road. There's a Native Hawaiian healthcare system. I think where the things shifted was really, and this is true statewide, was in the independent practice side of things. So there used to be other clinics, including the one that my location is in. So where Dr. Aluli was, and previously had Dr. Langer and some, other doctors were there, but that was it was a private, or it is independent practice. I know there was another Dr. McGuire used to be there. There was Mary Hoffman used to have another clinic. So there were, I think the key, there were options. Like there were other, it's a small island, but there were multiple, there's a couple of big groups, and then there were other smaller ones. And then what we saw over the course of just a few months to maybe 3 to 6 months, abruptly 60 to 70% of the island had a sudden shift in their access. So it's, the two main doctors, Dr. Thomas, who is a good friend of my dad, he passed away, and then Dr. Luli passed away, and those two alone had huge panels, and they had been long time docs for so many years, and so just the loss of those two is huge. And then a couple more, had left, a couple more closed their practices, so it was like this compound effect where there's no collateral, like there wasn't any other kind of um, in like people coming. And then there's, I think, on your island, even on our island, we have a lot of turnover, right? So we have a lot of people who they come, and we have that they come for locums and it might not work out, so then there's that. And then there's the standing kind of distrust of some of the care, the getting care to begin with, that's in every community. So
Yeah, I remember growing up, we had, our family doctors were family doctors for my parents, and and then as time goes on, we see that turnover. Yeah, in fact, we
yeah.
one of our my doctor moved, and so I got me a new doctor now. But doctor, you mentioned Dr. Aluli. Share a little bit about him and what he did for Molokai. And it was, two of the doctors passed away relatively close to each other, right? That was really the mainstay for a lot of the Molokai people. Maybe you can just share a little bit about them and how much they contributed, and how big a gap they left when they unfortunately passed away.
When even with that, I don't think I can do him nearly enough justice, right? Because so I worked, I didn't work with him in the clinic. I actually followed him more with the land rights thing, because I was my was Hawaiian studies, and so a lot of the things that they were doing more about preservation and conservation and land rights, right? So he was. I mean, it's just, I think so he did so much for the community apart from being a doctor, and I think that's one of the big things with the folks that we lost recently. So I mean, we had Dr. Blaisdell had passed away too, and I mean, these guys, they were just amazing for multiple reasons. So as a physician, they cared for generations, so he cared for generations of family, right? So I mean, they're still coming in, and it's been really, really hard for people to, it's not letting go, but to find what's next, because they're like, he was always there, like this is, from when I was a kid until I had my kids. He was there for a long time. And then he also, it was a lot of the community care beyond the clinic, right? So it's like a lot of my friends had spent really good special time with him on Kaho'olawe. They did a lot of the land, our Hawaiian rights and our land stuff really with him. And he was part of this kind of the group that started Ahuhu in Akauka, so the Native Hawaiian physicians. And they were always trying to think about how our health was impacted. So I mean, kind of the state of what we were, how we needed to get better. I believe they had the original Native Hawaiian heart studies. They were the original kind of like Renaissance man, where they were just kind of good and interested and just invested in multiple aspects. And there really wasn't any part of our lives that don't touch on health. And I think that was, even before it was trendy, like, or just clear that this holistic kind of idea, like, our identity as a Hawaiian, our relationship to the land, all those things, it impacts us, our health. So before people were really focusing on that, they were already talking about that. So I feel like that's the legacy that we have to carry for him, is just he didn't, all those guys, I mean, they really didn't get things easy either. So things were not handed to them. They just fought for what they believed was right. And for the most part, it was always about the community, and it was always about trying to do what's best for the people that they were serving. And it didn't always mean that it wasn't always an easy path. And I think that's what I always appreciated about him and about, Dr. Blaisdell and all these folks that went before me, is it shouldn't be this hard. I get it, but you're worth it. Like Hawaiians were worth it, whether we were led to believe this or understand this or not, irregardless of where you live, irregardless of what your quantum is, whether you're full Hawaiian or part Hawaiian or you're having to move away, like, you mattered and you deserved better. And I think that was that's at the end of the day what we're try to keep in mind, despite all of the challenges and all of the just bureaucracy that's built around us that we didn't build, and we didn't create, but we're suffering from.
I gotta believe it was so much easier back in the day when when those old time doctors. I remember we had they actually did house calls, and they would come over with a little black bag like in the movies, and that wasn't the norm. It definitely is not the norm now. But there are doctors like yourself that actually go out and visit the the communities. I know Doctor Governor Josh Green. He was well known for the street medicine that he and his crew were doing on Oahu, and I don't know where this takes us. Why is it that the Native Hawaiian and the Marshallese and all of these, I don't know how you describe them. I mean, they're underserved, but why is it? It's not just here, right? As we saw in the video, it is across the country, and it's typically people of color, whether it's
Yeah.
black or Asian or Hawaiian or Native Americans. But why is that, and what's the solution? Like I said, I know the Maui County Council decided that they needed to offer more healthcare and actually put some funds in there. But
Yeah.
what else? I mean, I mean, if we stay on this path, we lose people unnecessarily, and
It might sound biased, or like because I mean I am a PCP, but like from everything we did in street medicine, right? So when we first started doing street medicine, it was really good to learn and understand that everybody was insured. So almost 98% of them had insurance. So it wasn't the insurance part, it was access to care. And that, like all of the stuff we did from that kind of gave birth to this access to care, that the survey that a lot of people filled out. I think if you had to simplify it, one like and it is like it's really ridiculous to simplify like a super complicated thing. Access to primary care is probably the single best thing that we could do, and that requires investment in these providers, in these physicians and providers, because the more physicians you have, the more we can anchor other care. So but it's access to that primary care, and the reason being like I didn't appreciate it as much as I do now, but we help drive a lot of the care. So in the case of MedQuest, so a lot of people they need referrals from their PCP in order to access the next levels of care. If you have a PPO or you have other plans, a lot of times you can just go straight to. But when you are in a significant proportion of our population is MedQuest, they need a PCP referral. That limits their ability to access a lot of things. And so what we were seeing was a lot of the choke points. So then I would be there on the street and then be like, basically just a referral, like, okay, so you've already been seen, or, we're trying to get you someplace. Okay, so what can I do to get you to those places, right? Just coordinating care. And we see that like access to primary care is one of the things that's leading to better outcomes. So, I mean, just the ability during the pandemic to have somebody that you trusted that you could talk to and get basic health education and health literacy, ask questions from. I mean, the hardest part was when I realized like people my age, so I'm in my 40s now, right? Some people at my age were never they had never established with a PCP because they said either they were too busy at the time when they're younger, never need I'm young, and now they just couldn't. And so we're having people like a new generation who had no access to care, and so a lot of the education we were having to do was kind of like what we were taking for granted. So we're like, okay, so you and I might know if my arm is feeling numb, if I feel like there's an elephant sitting on my chest, we got to go to the ER. Some of these guys were going home and sleeping because they just thought they were tired, and then not waking up from a fatal cardiac event. And it was basically because we didn't never had those conversations. Like we never talked to them about what an MI looks like, or what we're worried about if you just had COVID. They didn't have access to care. So I think like I know it sounds biased, but access to primary care is probably one of the best things because we can help get them in behavioral health and the specialty care, and even if it's just social services, a lot of the social services just having a doc helping them access their whether it was getting their court. So I think we had to help with some court appointed guardianships so that they could access some of their other social services. that it's crazy. You don't think about, we don't, I didn't think about it, but like having access to a physician helped all that happen. So then I realized, like, okay, like that's why, as much as we can figure out how to amplify our reach or extend our reach in a safe way, that's got to be, it's got to be the next step. And that's what we've been trying to do. um, it's difficult, but I mean, I think right now we got to think outside the box, because we're past the point where status quo is going to work. And I think we got to do something big at this point.
Yeah, how much does housing play into the shortage? There's shortages everywhere for physicians, anesthesiologists, surgeons. I mean, it's specialists. It's like I'm waiting for a procedure. I got my kidney stones. It's like I don't know what the heck. But Queens Hospital, it's months out because they have a shortage of anesthesiologists. And here on Kauai is the same thing, right? We don't even have a oncologist here on Kauai. They fly in or they fly you out. How much does that have to do with housing? I know there were some comments in there about what if we were to set up, the state or the counties was to set up these housing um, apartments or something, just so we could get doctors here and not have to worry about paying $5,000 or $6,000 a month in rent, or
Yeah.
not having $2 million to buy a house. Is the housing crisis here in Hawaii partly to blame for shortage of physicians?
It certainly doesn't help, because we're like, we talk about that, where it's like, so I'm a business owner now. I didn't have to do this before. I was when I'm an employed physician, I just catch a paycheck, I see patients. Now I actually have to think about like rent. And so I mean, so a couple of the interesting points, right, is like county by county. I mean, it is far more expensive for the overhead on Molokai. And that's through, no fault of the island itself. But I mean, when your electricity bills are higher, cost to bring things on island is higher. Just the cost to get off island is higher. It's just, that factors into everybody's decision, especially when, I'm talking to some of my colleagues and I'm like, they're going to bring their family, right? And I think, the concept of where is it good to have to raise your family, they all agree. Like, I love the Big Island. I love Molokai. Like, these are good places to raise kids. It's just for them, like the cost of living, right? So then, like, I think it factors into the long term picture. It definitely makes it harder for me to recruit. Like right now, I drive over to Hapuna a lot of times, and I fly over to Molokai. We were super fortunate because the Mikami family, like, really, they helped us for right now, right? So they helped provide us housing, so that they were trying to take that off our plate. And then one of the church groups, or one of our community advisory people, provided us a car. So she's like, don't worry about it, when you need it. So that I know they're very humble. They don't realize how big a deal that is, because then it's like, okay, that's one less thing that we have to worry about. So when I have a provider, they have a car, they have a place to sleep. It's here, it's restrictive. It's like, I mean, on the Big Island, just rent is crazy. So even the affordable units that we were hoping they were getting in Waikoloa, um, it's hard. And then they got to deal with where the location. I know that for Kona, it factored in for a lot of my friends who were living. They're trying to get a contract. They were considering going down there, and then it's like, where do we live? How much is that going to cost us? And then just how livable is it, or how walkable? Like, there, these kind of considerations you have when you have children or a spouse, and it just wasn't panning out. They couldn't find a comfortable situation in Kona. A little bit easier on Hilo side, because we have a little bit more spread out. So people oftentimes will live in Kia'ao, or they'll go Honaka'a or Papaiko. But still, yet, I mean, just one, availability, the cost. I mean, it's difficult for the average person, and it's crazy to think that even your six-figure people it's difficult for them too. But it
Yeah.
factors in.
I know we have a lot of the people, they come to visit and they decide, this is where I want to live, this is where I want to retire, this is where I want to spend the rest of my life, and then they have the need to go to the doctor and something is not right, and then they realize, holy moly, when you move to a new place, that's number one. I remember, you got to think about where your kids go to school, and but it's healthcare. I mean, you if you're moving to a new place and you're leaving a big city that has all these amazing facilities and specialists and hospitals, and then you come here, you got to figure that into your formula when you decide, because you're going to compromise some of that. I do have a question here that I wanted to. Oh, but wait, I gotta put this plug in from the wife. Anybody
Okay.
wants to buy world's finest chocolate candy? My wife Patsy is going to be selling. There are a lot of fundraisers going on. A lot of our Pop Warner kids are traveling. So if you guys want to buy the very healthy world's finest chocolate candies, yeah, they're like fat free, calorie free, sugar free, all of that stuff. Um, make
No,
sure you
the goodness that you're doing balances out. You're doing something good, so it
correct,
balances. Yeah.
correct. But here's a question here from Jody. Are there any PAs or anesthesiologists being brought in as well as nurses? Are you
to,
aware?
to Big Island or to Molokai. Well, no, they. So I know the hospital has their set things. It's just they're like, and their calendar of specialists are just, they're easily accessible. So I mean, we don't do too many things that need anesthesia on that island. On the Big Island, we're having some challenge, and I think that would be a discussion for another show about scope of practice and some of the administrative decisions that are affecting some of my surgical friends, so like the obstetricians and the surgeons, and that is a different, because I feel like that a couple of interesting policies were kind of, or internal protocols were implemented, and it made a lot of our physicians decide to either leave or switch. And so, and I'll say that anesthesia in general, like it's hard, but we'll go away from that for now, because
Yeah,
that
no,
one is,
I,
there's a
I,
whole bunch of stuff with that.
I know. I was just talking to a friend who said we had lost a couple of doctors because of internal policy changes here on Kauai, and it is real. It is
Yeah.
real, and I think these administrators got to really focus on the big picture, and some of these policies maybe gotta not be so no rush. Here's another one. Oh, this is more of a comment on Maui. Even if you have a PCP, it doesn't mean you have access to care, because we lack specialists as well as mental health care. Delays in care are a huge issue and we rely on physicians to fly in from Oahu. And it takes 3 months. That is the exact same thing that's happening on Kauai. I mean, that is
Yep,
the.
and the Big Island, and that's the thing. So like, it's like, I get it what you guys are saying, because it's not so much that they have, so similar to the street medicine, they had insurance, but they weren't able to access us, right? So then it's like they were assigned. All these guys were assigned. So technically, they have a PCP. They were assigned somebody. But when we had asked them, "Hey, were you ever able to see them?" Like, no, we weren't. So it's similar, right? And this is where I tell people the biggest bane of my existence is the I was like, I deal with gaps, right? So we deal with health gaps in literacy, gaps in care and stuff like that. It's the perception gap. So it's the perception of what you think is happening and what is actually happening, and how many of us are comfortable just living with what you think is happening and not even considering that what you think is happening is not true, right? So I have all these conversations where the people are just like, yeah, it's fine though. I mean, there's that outpatient. They've got stuff, and I'm like, I'm telling you, it's not enough though. So like what Dana is saying, right? It's like, yeah, they're assigned a PCP, but they couldn't get in, and that was one of the. I did what we did was we came to Molokai as an urgent care, and I understand like a lot of people, they have opinions about it. That was not a right thing to do, but with urgent care, I can take them walk in, and I was explaining to them it doesn't necessarily have to be as emergent as you think it is. It might be that I can't see my PCP, like, and that might be your urgency, and we'll help you, because that's what I'm seeing. Exactly what you guys are saying is what I'm seeing, right? It's like you have a PCP, but you can't be seen. And by the time you can be seen, your problem has blown up. That come to us for, we'll figure that out with you, because that's access. Like having an assignment is one thing, but being able to access them is another thing. And that's that gap in perception where maybe some of the politicians are like, it's fine. They got insurance. They have people that they're assigned to, but asking them, are you able to actually see them, is the next step. And then are you able to actually get your problem solved, is the next step, right? And that's the accountability part that is really, really, really hard to nail in healthcare and in other things, but especially like that's what I've been struggling with, I think, over the last 5 years, is just what we think is happening is not. Like,
Yeah, well, the other things are not as critical as healthcare, and I think the focus really, and although we talk about it, right? Politicians and governments, and we talk about the preventive care. That's why it's so critical that we get, like, you talk about the person that may have had the pressure on his chest or the numbness on the arm and just went to sleep because he didn't know any better, right? He said, "Oh, I think I'm having a heart attack, but I'm not gonna go drive to the hospital." No, it's because they just think they're tired and they work too hard or they slept wrong or they you know but it's how do we get these people to understand healthcare, to understand that and I'm talking about the government. How do we make sure that that access is available?
yeah.
That's the struggle, right?
You think they would come to office? Because I remember one thing, I think it was maybe the work comp group, they had actually politicians come spend a day with them. I wonder if that would work, like you come and you just come be with my medical assistant and see. Like, I wonder if that would work.
I
Just
think it would work. I can tell you that the teachers union did that many years ago. I was on the council. This was probably 15 years ago or so. And what the HSTA did, the teachers union, what they did was they invited all the elected officials to go sit in classrooms and not just sit and mirror, but uh, actually go in and they gave you the lesson plan, and then the teacher left, and the politicians were left in the class all day to teach the lesson plan. And I did it my first year. I said, yeah, sure, why not? Sounds like fun. And I got assigned to Wyoming High School, juniors and seniors, and that was actually the. I remember coming home and telling my wife, the 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 today was worse than my worst day as a cop because, and this was a while ago when kids were still somewhat disciplined, but it's even worse today. But I got to see what teachers go through on a daily basis, and it definitely changed my thinking. And I remember contacting HST afterwards and saying, there's not much I can do as far as teacher raises because that's a
yeah.
state issue. But I'll write the letters of support, man. They deserve a whole lot more. The next year they called, I said, I ain't doing it no more. I don't want to do it. They said, no, Mel, go try the kindergarten. That was worse than the juniors and seniors.
Oh, it's endless energy, man. Are you kidding me?
It
That's
was
endless energy.
crazy. But I think something like
Yeah.
that with our elected officials at the state level, more specifically, all of these different committees at the legislature for public health and all these
Well, because
things.
it's driving me nuts. They'll come, and then I feel like they get put. So what happens is like a dog and pony show gets put on, right? It's like, oh, look at this, it's all great, it's all great, and I'm like, I understand that urgency, but I'm like, listen, things are not great, man. Like, I don't know who we're fooling here except ourselves, but so they'll visit, and it'll be like, look at this building, and then I'm like, meanwhile, I'm like, okay, all of these patients like need help. We're like we're calling people, no one's calling us back. Like, we're having to negotiate crazy things because these insurances are declining like life-saving treatment. And then but you're gonna come on island and go visit. Like, I don't understand that. And that to me, that's the hardest part because I don't engage in those anymore. Because, and that was so I did the rural health disparities thing, and I felt a little bit. I was like, I don't know if I should do this, but I told them I understand now that what I need to do is tell you guys the truth about what it looks like from we. I get it's like a how do you say, like it's a privilege, right? I get to sit with people in the best and worst of times, and I get to talk to people in the best and worst of times. And I think then I bring that back, and I'm the Debbie Downer. Like, everybody's like, everything's great, and I'm like, listen, so like it's not. And if I can't get more people to see it, I think I I think I talked to you about it, but like I had, we have some family. Like, my dad was going through some health things. Like, I've been, just mentally tired. My daughter had some, we're all going through stuff, and I realized like maybe my longevity isn't as long as I'm my days may be numbered because if I can't, this, like, we're gonna burn out. And so I think that's why I asked, we set this up to talk because it's just I don't know how much longer I'm gonna be able to hold this space, like, to
Yeah,
talk to you guys about it.
and you're not alone. I mean, that's the scary part, right? You're not alone because there's so many other doctors and first responders, that are experiencing the same thing. And I mean, we saw it a lot in COVID when it was ridiculous, and it was just, people were just getting really really sick, and hospitals were full, and they were setting up tents. But even after that, um, the burnout, you the burnout just doesn't go away, right? I mean, it's that body takes a toll. So as I told you on the phone last week, you cannot help anyone if you're not well. You cannot help anyone if you're not taking care of yourself. And at some point, you gotta, I tell this to cops too. Sometimes you gotta take a time out, and you gotta get some me time, because you
Yeah.
get burnt out, and you don't realize you're burning out, right? And then until it hits you, and then it's too late. So I tell you, we a lot of gratitude to you and all of those in the medical profession, because it's not easy. And again, government doesn't make it any easier. I would
No.
highly suggest you get you get some of these legislators to your clinic, and take them with you when you perform your street medicine. And I think I was just talking to did a video with someone else today, and I told them, we don't know what we don't know. Elected officials, decision makers, we don't know what we don't know. And when it's funny you said the dog and pony show. It's so interesting. Whenever we get invited to certain places, yeah, that's what they do. It's the dog and pony show, man. It's like, and I see through it because I've just been around too long.
Yeah.
But a lot of the young elected officials, they look at that and go, wow. And I'm like, guys,
Yeah.
it isn't always as it seems. And I'm not just talking about hospitals, but just in general. That's what happens, right? They put
Yeah.
on the best people up front, and everything's all cleaned up, shined up,
Well,
everything
it
is all
becomes like
good.
personal, right? And it's like I told it's hard because we won't ever be able to figure out how to help the problem if we're not willing to look at the problem directly. Like
Yeah.
so we just never see what's actually there because we're too. It's like it hurts our feelings personally to admit how far. How I mean, so I took care. I remember this one patient. Her family was just so upset because they had let her feet get so bad. So they were just there. I mean, they were just apologizing just profusely, like I can't, we're so ashamed, we're so and it's okay because I told them now that we see it, we can fix it, right? So it's like don't worry about it, we'll if you had let it go, any further, yeah, but look, the hardest part is looking at the problem, but then now we can actually make the solutions. We can take care of this and she will get better. So don't beat yourself up about like, but I think that's the hard part is like I sit and I'm looking around and I'm like, there's so much pride in, and I'm the same way, right? I mean, I remember with residency and stuff like that, we were so proud of our the program we had built, right? And to hear the very, you needed to be constructively criticized because we needed to get better, right? But it's really hard to hear that the thing that you've created might have some flaws. So I get it, but it's just that's the hard part for healthcare is we'll never be able to have like a real conversation because we're not, the people who I sit on this physician crisis task force too, right? And it's like the critical conversations that we need to have are not allowed to be had. So then, a lot of the people don't feel safe talking about the things that need to be said. They're worried that they're going to get punished by the insurers or by by other people. And so we're like, how much can we do to make this better? We all know it has to get better because we're all going down like, ooh. But if we can't have like a regular conversation, then we're never going to be able to kind of honestly make a difference, I think.
You got to acknowledge the problem, right? You got to accept the fact that there is an issue, and then before you can even start to address a solution. And I that happens a lot in government, where everyone's
Yeah.
worried that oh my god, if we tell the people we screwed up, oops. Well, sometimes you gotta own it. You just gotta
You
own it
do.
and learn from it and move on. Doc,
Yeah.
we got a few minutes left. I wanted to give you an opportunity. If you had the magic wand, if you just had that one magic wand, um,
Make me
what
a bird. No, I'm
what
just kidding.
what would you want to see, or what would you? In other words, let's say I'm Santa Claus, and what would you be asking for as it relates to this crisis of health equity?
I think about this a lot. And first, can I say it's a hi to your dad? So I mean, he mentioned he moved from Seattle. He moved. My auntie also had moved from San Francisco, and I know we had that talk about, is this a good place to live because of the care thing? So hi, Dad. Hi, everybody. If you had a magic wand, it's it's really sucky, but it's money, it's funding, and it's funding to the people directly providing the services, right? So it's like the people doing the work need to be better supported, because I'm not alone. Like I'm not the only one who's doing innovative things and trying to get things done, right? But just how hard they have to hustle to do the things that they need to do, and they know they're doing it for the, I look at these people and I'm like, they're doing it for the right reasons, in the right way, to the best of their ability, in really awful situation. And I feel the same way too, right? It's like people might not. I'm a few of them. I mean, I'm speaking directly to them right now. It's like people might not appreciate what you're doing. They might not even understand what you're doing, but they're still doing it. Um, those people need to get the funding. When we look around at who's the de facto voices and who's controlling, where the attention goes and where the money goes, they're not us. It's not the physicians. It's not people who are actually doing the work. It's often people, maybe in administrative roles or in, like health adjacent roles. So they might know stuff, but they don't know like the grind of what the people serving directly, right? They don't know that grind. They don't know the grittiness of what we have to do, and like the difficult choices we're having to make, while people they're hounding us to, we have to make money, we have to make, like, no, we have to make right choices. Like, we have to take care of the people, we have to make the right choices to help people get better. And that does not always mean that you as a company are going to make money. That never should be the focus, right? So if we had a way, that would be the magic wand thing, take away that need, that overhead thing that's hanging over our heads, that dark cloud that's like, I have to make overhead. I pay my staff, right? Misco is clear about that. Always pay your staff first. And you're as good as you are to your family as you are to your staff, right? So we do that. But if we didn't have to hustle as much to just survive, we could thrive. And I think that requires actually directing money and funding to the people that need it, and not letting it get caught up in these other people who don't really know what they're doing.
In the bureaucracy, right? And the
Yeah.
yeah, you got to buy food for the dog and ponies, guys. You guys cannot just let those animals starve, right? I did want to. My dad is on, and it's so funny. We did the village, right? The village. Hang on here. Remember the village?
I have
Um,
that.
yeah, the village. It's water, by the way.
Mine's too. It's
Ah.
boring. Not even, I don't even have Diet Coke. It's just water.
But as we went through several years of the Mel and Charlie show, and we got to know each other without even meeting each other, and it's so funny. My dad was on every night from Seattle, and unfortunately lost his wife and with COVID, and decided to move home. And again, that's a decision, right? You get awesome health care up there in Seattle. Now you come home, back home to Kauai, and that's one of the limiting factors you got to think about. But I got to tell you, I just am so happy that my dad is back home.
Yeah.
I'm just so happy that he's back home. Um, and one more comment I wanted to put up real quick, and this is from Desi. Kamehameha High School has created students and equipment to follow you, KHS alumni, and create a documentary in your street care. I think it's a great idea. I think the more we make people aware of the issues that we are struggling with here in Hawaii, not just with medical and or health, but with all of our crises. If we're not raising awareness with the people and giving them an opportunity to share, and like you said, constructive criticism is always really good. Without the hate and without the people are so easy, especially the keyboard warriors today. They really love the Monday morning quarterbacks. They need to go, but to be able to get the communities engaged and have our politicians, our elected officials, be in touch with their constituents to a point where they can make decisions that actually benefit the people that are receiving the care. That's a thing, right? I mean,
Yeah.
we got a lot of wealth in this state, guys. I got to tell you, we got a lot of wealth on Kauai. We got billionaires living here now, and not to say that they don't support the community, they do. But I mean, They could write a check right now, Doc, and fund your practice for 5 years without even blinking. And
Yeah.
you could, and then you could focus on treating people as other, except, other than trying to go out and look for funding and chasing
Yeah.
reimbursements. And it's a horrible thing. But um, yeah, I appreciate you
Well,
being on tonight. Any closing thoughts for our viewers before we sign off?
yeah, no, thanks for giving me a chance to just kind of talk about stuff. But I think about, because I was thinking about your dad, because that's one of the things that's kind of, it weighs on my mind for like Molokai in particular, right? It's like you, I'm from like Wahiwa, Haleiwa area, right? So it's like, your ability to go home and be with family, while when you retire, and just like have good, dignified kind of like retirement moments, and potentially, like, a lot of them, a lot of people want to die at home with their families, right? They want to be in their community, and I think that's the hardest part right now. Is like the situation is so junky on in that on that in that area, that we have people who are not able to do that, and now they're either going to have to move to be with their family on Oahu, or we're struggling to find them the support. So for what it's worth, I mean, I'm super glad that he's back with you, because I think about when my grandma passed when she was very young, so she's like 48 or something like that. She had colon cancer, right? And the whole family was there, like, while she was going. And there's the community part, it's like our ability to help and support them and be with family in the end moments. um, it's not We're not able to do that anymore in certain parts of our state. And that I think is, if you take away nothing else, like, all of us should at least have that, be the ability to care for our loved ones, our parents, our grandparents, safely, the end of days. And we should have the same access to the same kind of support. And that's not happening for a lot of our cousins and our families um, in the smaller communities like Molokai. So for whatever you guys, I'm here. I cannot. I know. I appreciate all the things that Dana, you guys are saying. I cannot. I don't have the capacity to engage like I used to. So I think I just want to put it out, just let you guys know. Like, I was burning so much time. Like, I can't do all of the extra stuff anymore. So I will. You guys can reach out, and I would love to talk to you guys more, but I can no longer be on like a million different things anymore. I'm trying to focus as much as time as I can with my daughter, um and trying not to lose my mind. So I say thank you guys for joining me.
Well, Doc, thanks again, folks, and thanks for joining us again. Don't forget to go ahead and subscribe to this channel, because we're trying to be doing this every Thursday night, and bringing up interesting topics that impact all of us in the state. I did start a Kauai County Council roundup. That's also on my YouTube channel. If you go to my YouTube channel and look on the playlist, there's one for the Kauai County Council roundup. That's just an update of our Wednesday's meeting. So for all of those of you on Kauai, you want to go check it out. It's on my YouTube channel. But yeah, don't forget to like it, subscribe, and click that little bell next to the subscribe button, because then whenever we upload a new video or we go live, you get notified. So with that, folks, thank you, Doc. Sending prayers to you, and give Auli'i a big hug for me and
Very
all of
well.
us here on Kauai. And then you guys stay safe. Oh, one more thing,
One
very
more thing.
important. It's Veterans Day weekend.
It is.
So to all of the veterans out there, especially my dad who did serve in Desert Storm, uh, God bless you all, and thanks for your service. And I'll probably
Thank
pop
you.
up a video on Veterans Day tomorrow as a tribute. But until next week, guys, aloha. God bless. We
And you
love you
also see
guys.
that. I wanted. Did you see the Governor Raposo? So
I saw that. That's my
okay.
friend.
Okay.
The Tyson Moyes is my friend. He's a
Thank you,
clown.
Tyson.
I don't think this state. I don't think this state is ready for Mel Raposo as governor. I just don't think that they are ready. So we'll
I
see.
got you,
But
Harry Kim style with my sign. I'll be there, so I will.
I'm not very good at dog and pony shows. That's the problem. People pick fluff over reality at every election, and I don't do well with fluff. So But anyway, I appreciate appreciate the suggestion, guys. Hey, you guys take care. As always, oh, okay, what's this here? This one is kind of bizarre. I think it's a typo. As always,
Yeah.
smells. Thank you
Proud of
for
you.
keeping us informed. I think
That was
that's a
probably
typo.
Mel.
Gotta be a typo. Anyway, hey guys, you guys take care. Stay safe. God bless. Happy Veterans Day. We'll see you guys next time.
Veterans Day.
Aloha.